that provide privacy to the patient. Hi, Mr. Peschke, how are you?
Good, how are you?
Good. My name is Riley and I'm a nursing student at Open University. So today I'll be doing an examination of your heart, lungs, and abdomen. So before we get started, I'm just going to wash my hands here. And then this whole exam takes about 15 minutes. So before we start, I'm just going to ask you a few questions if that's okay.
Okay.
And have you had any history of heart problems?
No.
And then what about lung problems?
No.
Or any abdominal problems?
No.
Okay, and then have you had any heart surgeries?
No.
Or lung surgeries?
No.
And then any abdominal surgeries?
No.
And then for your family history, has anyone in your family ever had any heart issues?
No.
Or lung issues?
No.
And then abdominal issues?
No.
Okay, so for social history, do you smoke?
Yes.
And then how much do you smoke a day?
Cigar a day.
How long have you been doing that for?
About a year.
Okay, and do you drink alcohol?
Yes.
How much alcohol do you drink?
Beer a day.
Okay, and do you vape?
No.
Or do you do recreational drugs?
No.
Okay, and for currently, do you have any coughing?
No.
Any shortness of breath?
No.
Any chest pain?
No.
Edema, which is swelling?
No.
Any nausea or vomiting?
No.
And then any abdominal pain?
No.
Okay, so and then just doing a general look over at you, your skin is a fair skin tone, tan with pink undertones. Your body is symmetrical on both sides. I don't see any lesions or abnormalities on the front of you. Your face is relaxed and calm. You are dressed appropriately for the occasion being at the hospital. Your speech is smooth and clear. I don't see any physical deformities on you. And you are 44 years old?
Yes.
And what gender do you identify as?
Male.
Okay. And then I just have a few last questions for you. Do you know who is president?
Yes. Donald Trump.
Okay. And do you know today's date?
October 23rd.
And do you know where you're at right now?
In the hospital.
And then do you know why you're here?
On an exam.
Okay, so all 4 of those questions were answered correctly, which means that you are alert and oriented times 4. You appear to be well-groomed and hygienic. And then now we will be moving on to your posterior chest. So looking at it, it is all an even skin color consistent with the rest of your body. Your spine is midline. I don't see any lesions or abnormalities on here. Now I will be checking for lung expansion symmetry. So I'm going to have you go ahead and breathe in and then out. And then do it one more time. Okay, so each side expanded symmetrically, and then I'm going to palpate here. And then did any of that feel tender?
No.
All right, so now we will be auscultating your back. I'm going to have you cross your arms in front of your chest to open up your scapula here, and then to listen, I'm going to have you breathe in and out through your mouth every time you feel my stethoscope touch you. If at any point you feel lightheaded or dizzy, just let me know so we can slow down.
Okay.
And I'm going to start right up here. Okay, so your lung sounds were all clear, and then we're going to be moving on to your neck and your carotid artery. So both sides of your neck look symmetrical. The skin is a consistent color with the rest of your body. No lesions or abnormalities on here. So I'm going to go ahead and feel your carotid artery. Go ahead and turn away from my hand. Okay, good. That rhythm was even, and it was 2+, and then I'm going to have you do the same on the other side. And that rhythm was even and 2+ as well. So now we will be moving on to your anterior thorax. And again, looking, it is symmetrical. I don't see any differences on either side. It appears that you are respirating about 12 to 18 breaths per minute. So now I'm going to palpate first, just right here, and then, did any of this feel tender? Okay, so now we will be auscultating the front of your chest, and then same as before, breathe in and out through your mouth, and then if you need to slow down, we can. So I'm going to start right up here above your clavicle. Okay, and then all of those lung sounds were clear as well. So now we will be moving on to your heart. I'm going to have you come over here and then just sit up right here.
Like, sit up.
Yeah, you can lay back. Okay. So we're going to be listening for 4 different heart sounds. I'm going to be using the diaphragm, which is used for higher pitched sounds like a heartbeat. So we're going to be starting right here at the aortic space, second intercostal space, right sternal border. And then pulmonic space, second intercostal, left sternal border. And then tricuspid, fourth intercostal space, left lower sternal border. And then the mitral area, which is fifth intercostal space, mid-clavicular line on the left side. And then all of those areas sounded good. So now I'll be flipping to the bell of my stethoscope, which is used for lower, sounds like a heart murmur in those same 4 areas. Okay, good. I did not hear any murmurs. And then with the diaphragm, I did hear both S1 and S2 sounds in all 4 areas. No abnormal or adventitious sounds in your heart. So now I will have you, we're going to move on to your abdomen, so I'm just going to have you lay flat. You can keep the pillow behind your head though.
On my back?
Yeah. So first we're going to inspect. It is even on both sides, there's no distension. Your umbilicus is even, all of the skin is consistent with your body. Your contour is flat when you lay down. And then now we're going to auscultate vowel sounds, starting with the right lower, and then moving to right upper, and then left upper and left lower. Okay, so vowel sounds were clear and active in all 4 quadrants, and now I'm going to be percussing. So I'm going to take my left middle finger and place it, and then I'm going to be tapping to listen for tympani in all 4 areas. So tympani was heard in all 4 areas, and then finally I'm going to be palpating each of the 4 quadrants. So in the right lower quadrant, do you feel any tenderness here?
Mm-mm.
Okay, and then what about here in the right upper?
No.
And then left upper
No.
and left lower?
No.
Okay. And then I did not feel any masses or any distension, so you can go ahead and sit up. And then I'm going to wash my hands. So I am all complete with my exam. Do you have any questions for me?
No.
All right. Well, thank you for your time. We are all set. And thank you, and have a great day.
Thank you.